we will deal with an disease of an arterial system. The first entity we are going to look to is the peripheral arterial disease. The peripheral arterial disease can come in different presentations, acute and chronic, or chronic. One of the common thing which we present in the clinical scenario is a chronic limb ischemia. What is a chronic limb ischemia? When there is a decreased blood flow to the tissue like muscles or the skin, which requires an amount of oxygen supply for the activity is decreased beyond a limit, patient perceives pain or gets symptomatic. That's when we call it as a chronic limb ischemia. It's more of an arbitrary clinical scenario what is chronic limb ischemia, but there are certain clinical characteristics put forward and certain clinical and objective criteria to put forward to call it as a critical or a non-critical ischemia, which we will see as we go through. These patients of limb ischemia comes to us with what kind of presentation? Let's come with the presentation. So there can be two kinds of presentation these limb ischemia patients can come with. One is the claudication pain or the rest pain. Other one is a tissue loss. When the patient is coming with a tissue loss like the gangrene, it's a straightforward case. We know that it's an arterial or any some other pathology. Whereas the patient presents with a claudication or a rest pain, we need to know what is the reason for the claudication. So let's first discuss what is called as an arterial claudication or what are the characteristics of an arterial claudication. So when do you call it as an arterial claudication? For it, to call it as an arterial claudication, first thing is the pain has to be produced on exertion. Say, if you are talking about the calf muscles, on walking, the pain has to be produced. And it used to be a cramp-like pain. It has to be a cramp-like pain. Third thing is, it has to be reproducible. The patient walks for a certain distance, experiences pain, takes rest, the pain decreases. Again, he takes a few steps or walks for some distance. Again, the same kind of pain is getting reproduced. So these are the characteristics to call it as an arterial claudication. Okay, these are the characteristics to call it as an arterial claudication. Why all this happens? Why does the pain happens? Basically, when there is a decreased blood supply to the muscles and the skin, when it is put upon exertion, still the activity is going on, isn't it? So the patient develops in what is called as an anaerobic metabolism in the tissues involved, which causes a substance P to be increased in the blood, which causes a local pain. That's how the patient presents with a claudication pain in an arterial disease. When the patient has managed with a claudication pain or is not resolved, then comes the what is called as a rest pain. What is rest pain? Rest pain is pain perceived even at rest. Simply put forward, it is nothing but pain perceived even at rest, but that is not all to it. To call it as a classical rest pain, the patient has to have pain at rest at the most distal part, foot or palm in case of lower limb and in case of an upper limb. Decreased, partly decreases or gets relieved on putting it the foot below the heart level, increases or progresses by rising above the heart level. These are the typical characteristics of rest pain, which disturbs his sleep or resting. Along with that, not relieved for period of 2 weeks in spite of analgesia, which involves both oral, parenteral, including that of opioids. Only then you accept it to be a rest pain. Why? Why so many characteristics has to be, why all this has to be fulfilled? Because rest pain is a clear indication for an intervention. Rest pain is a clear intervention for an indication, whatever intervention it could be, either a surgical or endovascular or whatsoever. So this means the patient has a critical limb ischemia. To classify this patient requires an intervention, we look forward to all these characteristics in the rest pain.